Hi, I'm Dr. Wayne Martinsen. I'm the psychiatrist at Dakota Boys and Girls Ranch. I've been here for 22 years, first as a consultant, and the last 16 years as an employee of the ranch. My job is to head up psychiatric care and the clinical team at Dakota Boys and Girls Ranch. So any child who comes in has a psychiatric evaluation in which we talk with them, talk with their family, talk with the referral. We look at old records, things that have been done in the past. Once we understand what their diagnosis is, we can take a look at whether or not a medication might help them pull their behavior together, improve their mood, and get them home to their families as quickly as possible. If a medication is indicated, I would work with the child, their family, the social worker or DJS worker to make sure that we have the right medication and to make sure that it's being well tolerated. None of the children at Dakota Boys and Girls Ranch are required to take a medication. All of that would be voluntary, and their parents are never required to or expected to agree to a medication. The children at Dakota Boys and Girls Ranch are both boys and girls, ranging from age 10 up to age 18. They generally have multiple problems. So these are kids with a lot of trauma. They often have serious psychiatric problems like depression with multiple suicide attempts, psychosis such as schizophrenia, autism spectrum disorder, some developmental delays. These are children who are often very deeply traumatized with parental abandonment, physical abuse, sexual abuse, neglect, and these are children with multiple psychiatric diagnoses. There's several things that make Dakota Boys and Girls Ranch different. Over time, we've developed an area of expertise with severely troubled children that I don't think you could find in the state of North Dakota. And that includes the fact that we're the only program, I believe, with a psychiatrist, with multiple nurse practitioners, with multiple psychologists, with any number of occupational therapists, occupational therapy assistants, and with psychotherapists. I remember back a couple of residents that we had in the early 2000s. The program in Western Plains, our Bismarck program, was very different then. And years after these two residents left, they later married, they've had 2 children, and they still see me for treatment of their depression and their ADHD. And it's been amazing to look at where these kids came from. The fact that they're both working, gainfully employed in the community, they are raising their children, and they're living a life, they're creating a life for their children that they never had the opportunity for. And I believe that it was our work as a team that helped them do that.